Okay, good afternoon, everyone, and welcome. My name is Sharnell Johnson, and I have Dr. Kimberly Sterling co-moderating with me today, and we have the pleasure of being the Women's Fund Grant Committee co-chairs for this year. We also welcome Johna Lee and Raio Krishnayya, who will be answering questions. They come from Alternatives and Cvhr, Center for Victim of Human Rights. And so we would like to welcome everyone and thank everyone. Found out this morning that we have almost 116 registrants. And I think this is a record for Women's Fund in their webinar. So we thank all of you for joining us. We're going to kind of just throw out some questions. We have some prepared questions for the two of our guests this afternoon. And then you guys have the opportunity to ask questions either in the Q&A as well as the chat. And after our initial questions, as we have time, we will go through those questions. Okay, so welcome again. And the first question I have for you is to please provide us with a brief overview of your organization and your services and programs. Either one of you could jump.
All right, I can start us off. So thank you to Sharnell and Kimberly and the Women's Fund for inviting us and giving us an opportunity to present. It's a real honor to be here and be a part of this. And as an aside, by the way, Women's Fund was the first foundation that supported Cvhr. So we have a long history with you. So it's nice to kind of be here again. So Center for Victim and Human Rights, Cvhr, was founded in 2008. We are a legal services organization. Our mission is to empower and advance the safety of victims through legal education, legal services, and educational outreach. So obviously we have two main things that we do, which is legal services and obviously the educational outreach. When you think about our legal services, they're sort of in four buckets, if you will. The most prolific thing we do is civil protection orders. We do probably about 350 of those a year here in Marion County. Just to give you an idea of the context of that, Marion County sees about 5,000 new protection order filings each year. And so we are still a small percentage of it, but we are sort of one of the most prolific legal service providers in the protection area, civil protection order area. The second thing we do is joint paternity and civil protection order issues. What we realized was that the kids are a big part of the intimate partner domestic violence issue, and what we realized is that there are other legal services that handle the divorce side of things, but there really wasn't anyone handling unmarried partners and addressing the kids in those situations. So we started doing those. And then the third thing is humanitarian immigration. So we're talking about U visas, which are for crime victims, T visas for trafficking victims, asylum. And then the fourth big thing is crime victim rights. There are federal and state statutes that govern the relationships between victim survivors and law enforcement and prosecutors. So just really from a demographic standpoint, we are, I would say at least 85%, if not more, are women and girls and of our clients. And then I would say the predominant sort of race ethnicities that we address are going to be mostly white, and then Black, African American, and then Latino. I would say it's probably about a third of each. And then we have a small bit of Asian and then other ethnicities and races as well.
Thank you.
Okay, it's my turn. And again, I would like to also thank you for hosting us today. This is a wonderful opportunity. I am honored that we are going to be the biggest webinar you've had. It really lets us know that these issues are important and people want to hear about those. So again, I'm with Alternatives. We are an organization that serves domestic and sexual violence survivors. All of programs are kind of assigned service areas. We can shelter anybody in the state, but we kind of assign service areas to make sure that everything is covered. So our 6 central Indiana counties are Hamilton, Hancock, Henry, Madison, Marion, and Tipton counties. So those are the counties that we predominantly serve. When I say we're an organization that serves domestic violence and sexual violence survivors for years, what I would start with is we are the shelter that serves that population. We're really changing that narrative. We're not just a shelter, and there's a lot more than just shelter, but of course our emergency shelter is still our largest program. We also have some in-house transitional housing units. So families, emergency, normally our average stay is about 22, 25 days-ish. With transitional, they can stay in those units for up to a year. So that really gives a family a chance to get settled and established a little bit. So it was a wonderful opportunity. We also have specialized programs for children while they're in our programs. So we have a program for school-age children, after school programs, summer programs when they're out of school. Of course, this year's looked a lot different. But we also have a preschool aged program for children. We're not a licensed preschool, but they're preschool aged. We also have recently started having some scattered site transitional housing units. I can talk a little bit more about those in a little bit, as well as rapid rehousing. So those are 2 new programs that we started just in December. So we're still learning and getting our feet wet and figuring all those programs out. But in addition to our housing programs, we also have non-residential services. Those are services for survivors that do not require housing assistance. For whatever reason, they have resources or family or whatever the reason, they just don't require housing services. And the last program is prevention. We also have a prevention program. Not as big as it used to be, and a constant reworking, trying to figure out what's going to work. But currently our prevention program is in middle and high schools. So it's preventing teen dating violence and sexual violence. So those are kind of our core programs.
Excellent. So thank you so much for giving the description of both of your organizations. You're doing so much in very variety of ways. I think it's important as we start this webinar to really talk about how the Central Indiana community can actually come alongside your organization. So can you give us some examples of tangible ways that we can help you as you serve women in this capacity? And perhaps, Johna, do you want to start? And then Raio, you can follow up.
Sure, I'll start. This one's an easy one for an agency such as ours. There's so many ways so many tangible ways to assist women and girls in our agency, since we are a shelter. So that could be, COVID has made things a little different, but post-COVID, I'll talk post-COVID, or what we will be able to do. Volunteering can look like anything basically here. We have groups that come in, provide a meal, an activity, a group after, just all kinds of anything. And we have sororities that will come in and do that, church groups. If your professional life has something that you can provide an actual educational group, that's great too. They kind of get tired of listening to us all the time. So having someone outside to be able to give their expertise is great. Obviously, we have a building since we are a shelter, so maintenance is always an issue. Outside landscaping, all of those things are easy things that we are constantly working on and doing. So If you're not so hands-on, supply drives are great too. We have lots of civic groups that will do supply drives. So, and I always say, what you use at home, we use tenfold. So anything you're touching at home, know that we need it here. So obviously food, personal care items, the majority of the survivors that come to see us have very little. So we're supplying all of that: shampoo, toothbrush, toothpaste, all of those things. Linens, we provide all of the linens, both bath and bed linens. So any of that. We also we give all the survivors that enter the shelter a welcome bag, and a basket, and they have kind of different things. The basket is more fun things, lotions and some feel good kind of stuff. The bags are more, they have a calendar, some pens, pencils, some things that they need as they're working to make some changes. We also have jumpstart baskets or supplies. So that's for survivors leaving the shelter. Anything that when they're starting over in a new home, it's endless. It could be kitchen kind of things, bedroom, bathroom, all of those things. So any of those kind of things. My last thing I want to say, it's not really tangible, but the more we talk about this issue, the more we speak out, whether you're a bystander and you see it, or at church, or your friends and family, just make sure that everyone knows that there are resources and we are here. And the more we talk about it, the more it's accepted, and it will reduce the judgment and the stigma around the issue. So like I said, I know that's not tangible, but it's very important. It's a very important piece of what we're doing.
That's great, Johna. Do you want to give your website real quick?
Sure.
Or at least type it in the chat for everyone.
Okay, now you're probably challenging me, but while I'm on my break, I will find it on here.
Great. Raio?
I would pick up where Johna kind of left off, and say that that's kind of really critical for us, which is really sort of, if you want to think about it, two pillars. One is education, and then the second is really advocacy. We know some of the statistics. It's 1 in 3 women. I was just reading nationwide, on an average day, 3 women are going to be murdered by a current or former intimate partner. The economic loss we're seeing is in the billions. So, taking some of that information and then turning that into advocacy, kind of like what Johna was saying, that is really important, because the work that we do, really being exclusively legal, so we're kind of a very different operation than what Johna is doing, but there's some similarities in that it's really focused on empowerment. And I think we can't move forward with these concepts of empowerment if we don't have people advocating for those policies. And, to give you kind of an example, one thing that I want to raise, if I could, is we know the Violence Against Women Act, VAWA, is up for reauthorization. And I think yesterday it just passed the House, but experts are speculating that that's going to be an uphill battle in the Senate. We need to have people contacting the policymakers and saying, we need to have VAWA reauthorized. We need these protections. Just to give you a little bit of an idea, one of the key things that the VAWA reauthorization is going to do is remove what's called the boyfriend loophole. One of the things we have to address, and our organization routinely addresses, is the issue of firearms in domestic violence issues. I always like to tell people that we're apolitical about the issue of firearms generally, but when it comes to firearms in domestic violence, our organization is going to do everything in its power to make sure that is not part of the equation, because we know that the presence of firearms increases the likelihood of a homicide by 500%. So when I talk about vow reauthorization, the boyfriend loophole basically says if the underlying act was stalking and you don't have a specific relationship between the parties, you can't ask that they be prohibited, that the abuser be prohibited from owning or possessing firearms. And so if it was just stalking, then you have an issue with regard to the firearms. And we know that stalking is often a gateway to something more violent. So in that respect, going back to your question, really having people educating themselves about that issue and really contacting their policymakers to vote in these key specific pieces of legislation, and really setting up that culture, even when they're having those one-on-one conversations. Most of the people that are in your audience are people who have some influence in their social circles. People listen to them. Help people understand what's really going on, that this isn't just the issue of a bad relationship, that there is a much greater dynamic and more complex dynamic going on here. And if we can kind of change some of the policy and the culture, I think we're really going to get some ground, both Johna's organization and our organization. So those are sort of the two key things that I would really ask people to do to come alongside us.
Okay, thank you. It's obvious that the work that the two of you do is so important. So I thank you and your teams for the efforts that you put forward and just showing up every day to help. So could you, if any, what are some of the positive or surprising things that have happened in light of COVID? Start with you, Raio.
Sure. So I think one of the biggest things that we've seen that's really been positive is how quickly the foundations community, including like Women's Fund, for example, have reached out to the organizations to say, what do you need to adapt to this work? And I would say one very key aspect of that is really funding fluidity. If you think about a funding dollar for an organization like ours, not only the amount that you get in terms of the funding is important, but really the fluidity, and that is the ability to use that dollar differently than maybe where you originally started. So to give you an example, when we've done a lot of our pre-COVID applications for grants, they didn't anticipate COVID. And then when COVID struck, we really had to significantly change our operation. And so one of the really positive things that came out of a lot of the foundational funding was the foundation saying, look, we're going to give you a lot more leeway to do it so that you can continue serving these constituencies as you need to change your operation as you need to. So that fluidity, I think, without us having to go through a lot of administrative bureaucratic hurdles, has been huge. So it's not even just how much you get, it's really how fluid it is. And the foundations were some of the first to step up and really offer that.
And I think I'm putting my finance hat on for a second, but unrestricted dollars is so important.
Yeah.
And with the changing, ever changing, maybe this is something that we can learn and move forward from post-COVID.
Absolutely. That's a great point. Yeah. And you guys have been the ones to really lead the way on that. I honestly, I wish the government, I know this is going to sound kind of silly to even say that I wish the government would do anything, but the reality is that they've not been anywhere near as flexible. I'm sure it's partly that they're removed from what the situation is on the ground. When Johna and I do our work, things change and we see it case by case. And when we communicate that to the foundations, you guys have responded. So I wish that message would get out further, but that's really one of the most positive things that's come out.
Okay, thank you. Johna?
I agree with you full-heartedly. And in the beginning of COVID, the Women's Fund was the very first foundation that reached out and said, how can we help? So yeah, appreciate that very much. And I will also agree that government funding is, I mean, I would go out, venture to say even say it's zero flexibility. Basically nothing really changed as far as that funding goes, but maybe we'll all keep our fingers crossed that they'll learn a little bit from this and give us back a little bit of the freedom to be able to serve people the best we can with what the situation is. But anyway, I didn't mean to get off on that, but as far as what we have, some positive changes that's happened with us, we're like most shelters that prior to COVID, our philosophy was anybody that needs services, let's get them in. We'll figure it out, cots, floors, all of the places, let's get that figured out. And through COVID, because we had to restrict shelter capacity to keep everyone safe, last thing we wanted is to have a shelter full of 50 people that all had COVID. So we all reduced our capacity. And the thing that we learned is that touching less, we were able to provide much more quality services. So it became quality over quantity. So before, what we thought we were doing the best for everyone ended up not, we've learned wasn't necessarily the best. We were able to help much, we're able to get to much more of the issue rather than just what's on the top and the immediate and let's figure it out and that kind of thing. So that was a very positive thing we learned. We also learned that technology is a good thing. In our field, we've always face-to-face is what we thought was best, and technology always felt a little insensitive, and so we really steered away from it. Well, we learned that that is greatly reduces barriers for survivors. We have cell phones, iPads, virtual meetings, all the things that we're doing now. And we are actually having a lot more contact with survivors in our non-residential program, and then after they leave, than we ever have before. That convenience for them is much easier for them to access our services and to stay connected. So we also learned that what we thought was what survivors wanted, it didn't necessarily was the case. So we've also learned that, which I'm going to touch on a little bit with a later question, that that survivors are very resourceful. When we had to reduce our capacity, we learned that shelter isn't always the most important thing. Sometimes it was a car repair is all they needed to keep peace in their home, or to keep them from needing shelter, so they didn't have to pay for it. So we learned that it could be anything. All of the little things that just seemed little to us before, we've now learned they aren't little, and they reducing those barriers can really make a big difference in survivors' lives. And we also learned to think outside the box. We've been trying to do that over the last few years. The Indiana Coalition Against Domestic Violence has convened groups of shelter or domestic violence providers together to talk about our service model and what's working and what's not, where we need to make some shifts. So we've been moving that direction, but this kind of forced that on us a little quicker. Mobile advocacy may be something that some of you have heard about. So rather than a brick and mortar building, we are mobile and go to McDonald's or go to the library or go to all of the places in the neighborhoods where we're serving, rather than having a survivor have to figure out how to get to us. So, so this pandemic has really, the direction we were going, it just forced us to get there a lot quicker, I guess. And we also learned that it is doable. you know, what we thought before was, you know, that's going to be really difficult. We learned it really isn't that difficult. So
We really appreciate your reflections on what we gained in terms of technology advances and the use of them to carry us forward. This would have been probably perhaps a live discussion, but we're able to incorporate so many more people by using technology, Johna, you mentioned, and also giving us an understanding of what your organizations learned. And so I'm curious, as we pivot to a question around the people that you serve, the women that you serve, as we transition out of COVID, whenever that fully takes place, what do you believe are going to be the biggest issues that survivors of domestic violence will actually face? And these biggest issues as we transition out of COVID, are these actually different than what was happening before COVID? Can you share your perspective?
sure. I think the biggest thing that concerns me moving forward, when we transition out of COVID, is the aspect of isolation. That's not new to domestic violence survivors. However, I think, and we're hearing that perpetrators, you know, for the last year have had permission. They've been given permission. What they did before, you know, they figured out how to do, but now they've been given permission to isolate the survivors. So it concerns me of how to once things do open up and that they're not able to use that any longer, if that's going to put survivors at risk, it's a little concerning to me. Another thing that we've seen is survivors have had to make a choice between employment and their children's schooling because of virtual school. You know, they no longer had you know, the resources they had before. They are now become teachers, trying to work, trying to teach their children, keep all of that up. And so as we transition out of that and kids get back to school, you know, how are they going to get back in the workforce is a little concern for me. And I also, you know, as we transition out, as the eviction restrictions are lifted, what that's going to do. At this point, there's a lot of assistance out there, and the restrictions are still there. I have not checked this week whether had extended those eviction restrictions or not, but that's a concern. So, you know, right now they're still housed, and after the assistance is gone and the restrictions are gone, I'm afraid that it's just going to be flooded with survivors that no longer have some place to be and are going to need to be somewhere. So those are my biggest concerns.
Okay. Raio?
Yeah, I think I would echo a little bit of what Johna said in terms of I guess the way I like to think of it is pre-COVID, you know, there was sort of a level in terms of all of the mechanisms of abuse that occurred in domestic violence. And I feel like what COVID did is it just exacerbated it. Like it just made it much more intense. It gave abusers many more opportunities and vehicles for exacting that abuse. That poisoned well is kind of how I liken it. So I think there's going to be some unknowns in terms of what are we going to deal with when we're on the other side of COVID. I think especially around technology, we're probably going to see an uptick in terms of the use of technology as really a device of abuse. We were seeing it obviously when we were talking about things like stalking. We were seeing it in the past, but I think we're going to see a lot more of it going forward. I would say on the legal side of things, you know, the big issues are really going to be those aspects of empowerment. We're talking about things like childcare, like you heard with Johna. I think how you handle parenting time. How can we handle the child exchanges safely? How are we going to handle violations of parenting time? What, a common tool of abuse is to use the children as a pawn. So how are we going to be able to enforce that stuff? So really access to justice issues in that respect. And then I think it's worth noting that just sort of dovetailing off of something Johna said about housing. I've been watching the housing issue. It's not something is sort of a predominant service that we're into, but we are absolutely considering it because right now the moratorium is in place until I think it's March 31st. And then after that, we don't know what happens. And I think I read an article that said that potentially 700,000 households are going to be affected if the moratorium is not extended. And you can pretty well guess that that's absolutely going to affect the populations we serve. I think that's one big ticket item. And then I think a second big ticket item that's out there is really some of the stimulus money. So the first round of stimulus money that came out, the Indiana Supreme Court essentially issued a rule that said creditors couldn't attach to it. So, if you're a survivor, you can use that stimulus money for childcare things, for things that directly address what you need to address. But on the other side of that, the second round of stimulus money, the Supreme Court declined to extend the protections of that stimulus money from creditors. So how that's going to impact our clients exactly, we don't know. We don't know if, for example, if the abuser's credit problems are going to then translate to taking away from our clients because it'll be viewed as a common household. So, these are all issues of empowerment, and those things are going to be things that end up being litigated in the courtroom. And I think we're going to see some tall hurdles to have to get over to make sure that we are protecting these issues for our survivors. So I would, if sort of itemizing it in terms of empowerment, it's really going to be the housing and the childcare. I would say also firearms on the safety side of things is going to be a big ticket item too. We saw a huge spike in the purchase of firearms right around the beginning of COVID. Again, the presence of firearms in domestic violence situations it's devastating. I just don't know how bad that's going to get, but we have to have a mechanism in place for addressing that stuff. We have some, but I think this goes back to something I said earlier, which is your audience members, if they can get involved in terms of advocacy, talking to their friends, talking to the policyholders, saying, look, these are big ticket items. We can't have a crisis out of this. That's so important. So.
Sharnell, if you will let me, I wanted to ask a related question because both Raio and Johna brought up children and the impact that's happening right now. We received a question that I think this is a good time to ask it is, how, if all, do you address the mental health of children for whom you provide services, especially during COVID, where many of them weren't able to connect with friends in school? We talked about isolation being a big concern. I'm curious if there's a quick answer you want to provide back to that question before we transition to the next.
So I would, just for us, I would say that's not a primary service of ours. We're legal services exclusively. That's not to say that it's not important. And of course, we're always trying to connect to our partners. We just can't do everything, and we need our partners to really be alongside us. So that's kind of an issue that we would absolutely connect with partners to address. I don't really know how extensive the services are to address that issue specifically. And so I think Johna is probably in a better position to answer that in that respect.
Well, I wish I was. This.
Sorry, I didn't mean to put you in a bad spot, Johna. We just don't. Yeah.
Yeah. I mean, this has been an issue that We, as service providers, have been talking about for a year. We have bi-weekly calls where all of the directors get together and talk, and this has come up almost every call about how can we provide services to ensure that children are not isolated to the best of our ability, and keep everyone safe and listen to all the guidelines and all of the things. And no one has yet come up with this great model to be able to do that. We have been trying to reach out to the kids daily, checking in with them. Our children's case managers are, we have a partnership with Anderson Community Schools because we're actually located in Anderson. So we have access to their schoolwork. So we've been trying to, that be the segue in that, we know you've got this assignment done, and that gets us some time with them, and then we can work around that. We actually just had a child yesterday issue. Mom says, she's being disrespectful and all of the things. So when our case manager sat down with her, she just unloaded all of the reasons that, this world is hard for her right now. So yeah, trying to figure out a plan for her and how do we help her work through all of this in the midst of, we've always dealt with these issues, particularly, kids, a lot of times we'll hear from a survivor that, the final straw that made them lead to reach out to us is that one of their children was hurt or heard something, and we have to tell them, your children have known it all along. So our kids come to us with so much trauma. And so it's something that we're constantly dealing with, but now with the isolation, it's just added, makes it even more difficult. So if anyone out there has this great example or service or some kind of model that we can look at, we definitely would, because yeah, it's concerning. It's very concerning.
We've talked about a lot, and a lot of it's been eye-opening, even for myself. I didn't really understand. I think we get, blind, we have this bit, we live in silos basically, and don't understand all of the things that are going on around us. So again, thank you guys for the work that you're doing. Have a question from the Q&A that what are the demographics of the women that you serve, and how do you address cultural competency in your programming?
I'll go first. Our demographics it depends on what program, to be honest. Our shelter program, well, I could probably pull it out and give you exact numbers for the last year. But about 30% of our population, well, about 35, are African American that are in our shelter. Hispanic, probably about 5. When we get Asian, even lower than that, 2 or 3, and the rest are Caucasian. I can't tell you exactly why, but our non-residential services seem to predominantly be white or Caucasian. I am not sure why. I can't explain it, but the percentage of African American is below 5% in our non-residential programs. So yeah, I'm not exactly sure why, but I forget the rest of the question, Sharnell.
Oh, it's how do you incorporate, or how have you incorporated cultural competency in your programming?
Yes, so this has been, we've been working on this for a couple of years now. Mm-hmm. We established a diversity review team. So on our team has a member of each one of our programs represented, as well as a board member. So our first task, obviously, we're looking at policies and that kind of thing. So it was a lot of global stuff. Our language and our imaging and those kind of things is what we worked on first. COVID has kind of slowed us down, our momentum down, obviously, like it has most things. But we're still working. Our residential program is the easiest to get to because they're kind of a contained audience. They live with us. So we have access to them at some point every day. So we've established a group that we work with our residents to talk about these issues, have them give us examples or situations that we did well and those that we did not. We've had lots of really good suggestions, and we've made programming changes. Some things as simple as, ethnic hair care products. We've always had those, but it's not something that if you come to our shelter, how do you know that we have those? So now in their welcome bags, there's a little slip of paper saying, if you need something that's different, let us know what that is, and we'll take care of getting that for you. That was a suggestion. So, survivors said, well, we didn't know, or we've had them suggest group topics. So we've changed our group curriculum around suggestions that they've had. We, of course, all of it, we survey, a requirement for most of our funders. So we survey in all of our programs. Again, a residential program is the one we probably receive, well, not probably, we do receive the highest percentage of responses. All of our services are voluntary, so we are not allowed to require anything. So, whether they complete that or not is up to them, but so we get a lot of good feedback. So we have been working towards that. And like I said, COVID has kind of put us back a little. So we're ready to try to get back on track with that. But
so for us, we had pulled a little bit of data between sort of January of 2019 to December 2019 and January, December 2020. And just looking at our protection order cases, I think I had mentioned earlier that it's sort of a third in terms of, white, Caucasian, Black, African American, and Latino. We did see a significant dip in 2020 with the Latino population. And one of the reasons we have learned as a reason for that is because the immigration issue really becomes a central issue. So there's really two things that were kind of interesting there that are at play. One is the immigration issue. And along those lines, one of the things that we deal with is there is sort of a urban legend out there of a victim of domestic violence in Texas who sought a protection order in, I think it was Houston. And then after she filed the protection order, ICE was waiting for her, picked her up, and deported her. And that's kind of how that it sort of spreads. You'd be surprised how fast those kinds of things spread. And so that's sort of one thing that's going on. The second thing we learned really was that when the immigrant population kind of reaches out for legal services, if the abuser learns of it, they don't just effectuate the abuse here, they effectuate the abuse at home. So they have their family members exacting sort of revenge against her family members back home. So, there's a lot of pressure there. And so the way we deal with that, we sort of have two ways of handling that. One is we do have a interpreter translator position in our office for Spanish speaking clients. For the ones that are not, we would use Luna Language Services. So we really appreciate the help that they provide. The other thing, candidly, is reaching out to cultural specific organizations. Those organizations are going to be a lot of times frontline. So a good example would be, for example, like La Plaza. clients are going to reach out to them first, and they're going to say, I need help. You are culturally sensitive to my needs. There's an identity piece to that. And so they reach out to those organizations. And so as a result, what we do is we reach out to those organizations and say, look, there's a myriad of legal services that your clients can avail themselves to. Let us help you bridge that gap of messaging that so that we can start to tap into those communities. And what we find is ethnicities, races, even LGBTQ populations that don't have access to those culturally specific organizations, they have a larger gap to cross to really receiving our services, because they don't have a culturally specific organization that represents only their interests, or a place where they sort of feel safe before they contact us. So a lot of times we're a second tier organization. They may go to a shelter, or they may go to a social service organization that addresses their specific identity, candidly. And then they come to us. And so it's so important for us really to have those partnerships. And that's really a key in terms of addressing cultural competency.
Thank you.
I wonder if we keep in line with the partnership theme. We received another question. Given that we are talking about Central Indiana organizations, and we know that victims come from all over the state, if you have a victim, or excuse me, a survivor, that actually reaches out to your organizations, but let's say they live in another part of the state, like Northwest Indiana, do you have partnerships in other parts of the state to connect them? That was a question of one of the participants on the call today.
So for us, the answer is yes and no. So for example, protection order services, we exclusively work in Marion County. For a while, we were working in some of the surrounding counties, representing directly there. But what would happen is that we would use a lot of resources traveling to and fro to those counties to represent a client. And what we found out is in that time, we could be doing additional services for other clients in that commuting time. So because the need in Marion County was so high, we stuck exclusively with Marion County for that. So when someone says they need help with a civil protection order in a different county, we do connect with the Indiana Coalition Against Domestic Violence. I'm sure many of you know Carrie Bennett, who's their legal director, who really helps connect survivors to legal representation there in other counties. But if it's, for example, a humanitarian immigration case, because of technology, we're able to interview them, we're able to connect with them. We don't actually have to be in the same county as them. So we do get a lot of those from different parts of the county, or the state rather. So we do that. And then in certain circumstances where those aren't going to work, we do have a good partnership with Indiana Legal Services, for example, who does have offices throughout the state. So we will reach out to them to see if this is something that they can take where we can't step up.
Johna, are you able to do something similar?
Absolutely. The shelters are all a network of service providers, and I shouldn't just say shelters. There are non-residential programs, but we are a network, and we all work very closely together. So if a survivor calls from a region outside of ours, the first thing we tell him or her is that they need to contact their local. We'll get connected with their local shelter or organization, so for their immediate safety. I mean, that's what's immediate. Last thing we want is, while we're trying to figure out how to get them moved, something happens. So let's get you safe immediately, and then we all work together to make sure that that survivor is housed in the community that works best for them. So sometimes it's because of safety. They need to leave wherever they are for safety, because he has found her and she's been there before, or what have you. Other times is they've relocated and their support system is here. You know, they all of their family is here. This is where their support is. So we're oftentimes sheltering someone from outside of our immediate service area. Absolutely.
Great. Sharnell, do you want to take the next question?
Yes, I will. So this is for you, Johna. Housing policy has moved towards housing first. We're getting individuals within a home and without a home into housing, then providing services. So how has this impacted your housing model? And has this impacted your funding? And then I have a follow-up question.
Okay. So yes, housing first is a model that we're all moving towards. It's some of us can move a little quicker than others. It's a little slow moving, but it is definitely a model that has a lot of success. And us, like most other shelters across the state, are looking at making that shift. We, as far as alternatives, we have a board subcommittee that is really taking a deep dive into what that looks like. Mm-hmm. We have recently, I mentioned earlier about our scattered site transitional housing and our rapid rehousing. We recently received that funding, which is increasing our ability to be able to do that. We work very well with our coordinated entry, which happens to be Aspire in our region, but their funds were limited, so we were able to tap into some funding. We would actually have more. We have 13 scattered site transitional and 10 rapid rehousing units. We would have more if there wasn't a federal match requirement that makes it difficult. Our grant is $327,000, so when you're matching that 25%, it can create some barriers, but that's what we were able to do. And so, yes, and we're seeing a lot of success with it. So our board committee is really, like I said, taking a deep dive into this. We have a shelter facility that is, as far as shelter facilities goes, fairly new. It's 16 years old now, which is new. We built it back in 2005. So it's a huge asset of this organization. It's worth $3 million. So it's not something you can walk away from and make that total transition to this new model. But we're looking at our service delivery and how to change our current service delivery. There's some states that have already made this shift a lot quicker. And so we've had trainings with those states to look at how to do it, what works, what didn't work. So yes, we're in the process of that. We've started that shift. As far as funding, again, that takes some time. Some of our funding is multi-year funding. So trying to navigate, a grant that just started, that's 2 years, and figuring out how to make some shifts in resources. But that is something else that we're currently doing and looking at. So it's one of those, I'll say, stay tuned. I'm guessing within a couple years, alternatives shelter will look much different, and our service model will have made a big shift, and will be more of the housing first model, and the mobile advocacy is what I'm thinking will happen.
And just real quick, does alternatives serve victims of sex trafficking? Is that part of your population?
We do, however, it's not something that, it's not our area of expertise. A lot of times they will come to us as a domestic violence survivor, and then we learn more about their story and figure out that that's what actually was happening. So we do. It's just not one of our primary services.
Okay, thank you.
Mm-hmm.
And Raio, if you could tell us a little bit about the mix, and you may have addressed this, but just as we're coming to a close, how have the types of cases changed during COVID, the mix of the ones that you've been working with, given that everyone's been locked down, isolation? less or more technology. You talked about that being used as a tool of abuse as well.
Yeah, great question. Thank you for asking. I would say the case type hasn't changed so much, but really the policies around how those cases are addressed has changed. I will tell you, it's being very blunt and stark, but one of the things that's happened is for our protection order cases, the courts are holding those cases in person. And you know, we have a fair number of people that are medically vulnerable when it comes to something like COVID. And we've heard some of them say, look, if we can't do this virtually, you're asking me to choose between protecting myself from further acts of domestic violence or risking getting COVID, because these cases are being heard at the city county building. And as I'm sure you can imagine, the city county building it's a dense population site. So what's really happening is it's really hard when we ask for virtual hearings to really get those virtual hearings. So I think in that sense, that is sort of a big policy change that affects how those cases are being adjudicated. I don't know what transpires after that in terms of, you know, will some courts start to move more into the virtual or not? There are courts that are adjudicating cases, especially on the criminal side, that exclusively virtually. So I think it can be done. I just, you know, it's an issue that's sort of come up in that respect. But if there's sort of another sort of major thing that we really are focusing on next is really appeals. And the reason for that is because what we've realized is it's one thing to advocate in a case by case, but you only end up advocating in that case. Whereas when we take an appeal, we are essentially working on a policy that then occurs statewide in the courts. So that's really kind of a key shift in terms of what we are trying to focus on in terms of case types. But post-COVID, I think it's going to be really an issue of who can access the technology and therefore access those legal remedies that are really critical to safety and empowerment.
Great. Thank you so much. I know we only have 2 minutes left for our participants or attendees today. I wanted to let you know that we have placed website information for both of the organizations represented today. And as we're wrapping up, if you can spend maybe 30 seconds as we talk about the mix of the client base. We talked about, at least for Johna, yours is primarily a white base. Raio, some of the cases that you serve are more of a 30-30-30 for some of the demographics. How do you think the impact of your case mix is dependent on the demographics of like your staff, your volunteers, and your board? And are you doing some outreach to those communities just as we wrap up in the last 30 seconds?
Yeah. Yeah, I think it's I think less about our staff and more really about the values of the organization. You know, what we really want to drive home is that we are there for everybody. If you're a victim of domestic violence, regardless of where you come from, you should have access to these legal services. That's it. And it goes back to something I think we said before, which is what we realized is, and all the way up to the board down to, you know, the law clerks who work with us, is we have to connect with our partners. We have to do this work with our partners. We can't work in isolation because otherwise we are missing out populations that make up this community, and we are serving this community, and we have to serve all of the community. So unless we reach out to those partners and say, how do we connect with your constituents? We're not going to be successful in hitting those underserved populations. So that partnership piece is really probably the most important thing. And it is part of our values from the board on down to the staff. So that's really sort of, I think, the key piece for us.
Great. And then Johna Lee, you'll have the last word in the last 30 seconds. We're at the top of the hour.
Okay. I would agree that I don't know that it has as much to do with our staff as maybe the cultural issues. You know, Raio explained earlier about the Hispanic community and the culture, if they reach out, what happens. And so it's a struggle. You know, our board is committed to this and trying to figure out how we get that messaging out, to just reach out, that we are here. We serve anyone and everyone. It's a hard issue to wrap around why or why not. It's like I said, why is our shelter serving so much more a diverse population than our non-residential services? In my logic, it should be reversed, maybe. I don't know, but we are constantly looking at how to make sure that everyone knows that we're here, and trying to be culturally sensitive to those specialized type of issues, so that we understand that this is why things may look different, why you're not reaching out, why why. We also try to, when I talked earlier about speaking out, that's important too. If the more people that know prior to needing us, the better off we are. You are more apt to reach out for help if your sister, your neighbor, your priest, someone is telling you that this is a safe place. So, continuing that outreach to make sure that we're reaching diverse populations, so that word of mouth can put people at ease and have them able to reach out.
Thank you so much to Raio, Krishnayya, and Johna Lee for participating today. We really appreciate engaging us, and we've learned a lot about what you're doing and the work that still needs to be done in Central Indiana and throughout the state, as it relates to violence against women. So thank you everyone for joining us, and we look forward to further engagement through Women's Fund. Have a great day.
Thank you, everyone.
Take care.
Thank you.